For the discussion zone. So today is World AIDS Day, the 1st of December 2021. That's actually a yearly thing. So since inception in 1988 as an international day dedicated to raising awareness of the AIDS pandemic caused by the spread of HIV infection and mourning those who have died of the disease. And our big question has been about when was how often do you check your HIV status? How often? I have my colleagues here, Mummy and Master Jeff. Anytime I mention your name, I think about Jeffrey of what? Fresh Prince of Bel-Air.
Oh yeah,
Yeah, my favorite character. One of my favorite characters.
Yeah.
The guy from the Queensland, huh?
Yeah.
Amazing. But how are you today?
I'm good.
Nice. I would ask you the question that I've been asking my audience. How often do you check your HIV status?
Chastity is a thing for
Dude,
the young man sitting
I
here.
just asked you a question. I'm not asking you to stop
It's
preaching.
in line. It's in line with what it is I need to answer.
I'm not asking you to what cry. I'm even lost for words, but just tell me.
Give you a background.
That's it. Don't start preaching or start sounding like a clergy.
Oh no! When I start like that, it looks
Have
like,
you ever tested?
Have I ever tested? No, I haven't.
You're kidding. How old are you? Okay. Oh, okay. Maybe that's something you wouldn't want to reveal, but I'm sure you're more than 10 years. You're more than 20 years. So,
Yeah,
so let's say 20 something. Let me just give you an age. Let's say 25.
20 something.
25. Okay.
Okay, so it's been in a mix of other tests, as in not solely on its own, but then.
Okay. So whilst you were required to take a certain test,
Yes.
that was included.
Yeah.
So that's kind of like by accident or by chance.
By chance.
So you did it and you realized, oh, Charlie, this one cried. I mean negative.
Yeah.
Wow. But you never deliberately
No,
walked
not deliberately
into
went in like, today, my menace, give me whatever.
HR, and check my status. Amazing. In this room, we are like what? How many? Who has actually voluntarily checked for HIV?
Ima.
Okay. Perfect. That's fine, Mr. Scarlett. What about you? No.
Oh.
You? No. So 1, 2, 3. So 3 people, including me. Yeah, I know you've raised your hands. Okay, mommy. Yeah. Before I ask you, I know you have already. Why? What made you take that decision?
Okay, so the first time I took the test, it was after I had completed SHS.
Okay.
And then I came to the house, and then my mom was like, have I ever done it?
Then what?
Have I ever had an HIV test?
Why you laughing? I mean, Jeff, what's funny?
No, you said that
the pause in it was making it sound,
Something else?
yeah, it was like,
Outrageous.
coming with something else. So I was wondering.
Done what?
Done what? Done it.
It's just like
What is
you know,
it?
it's just like when you find yourself in this epic situation, you know, that kind of epic movies you watch. Like, so you have started this early with who?
With who?
Okay.
Yeah. So then she asked if I ever did an HIV test, and I was like, no. Then she tested.
Right.
And that was in like 2013.
So that was in the house. I want to believe.
That was in the house.
With the little test.
Yeah, with a little
kit.
test. You know, she works in a clinic.
Yep.
So
Yeah.
that was my first time. And then I think the second time was early this year. And I think around like April.
Okay.
Yeah, I think one day after church, my mom was on duty. So after service, I was like, I haven't done an AIDS test in like 8 years.
Okay. So the first time you did.
So the first time was in 2013.
Wow.
And then I didn't do it again. Then I think early this year, like I was saying, after church, I was like, my mom is at work.
Okay.
So usually when she's at work on Sundays, I go there and then I check certain things like my blood, my
Level.
blood pressure, my blood counts, like those things.
Right.
So when I got there and she did those things, and then I was like, okay, then let me just do an HIV test, and then I did it.
Okay.
And that was in April. Then in July, I went to the
year?
early this year.
Wow.
And then in July, I went to the hospital. I had to run a couple of tests to do.
It was included.
Yeah, I didn't actually tell me.
Oh, without your consent.
Without my consent.
Did you sue them?
I didn't.
We could have had a lot of money then.
I
Yeah?
know.
You want to go back?
So,
Well, I'm not. I'm thinking about.
so I think I saw it when the results came back, and there they don't write it as an HIV test; they write it as a retro screen.
Right. Right.
So it came back, and then I saw it. I was like, "Yo, why? How do you text? How do you test me for HIV
HIV
AIDS and
without
not tell me?"
informing
And
me.
I think that was because patients are not supposed to open the lab results.
Right. The doctor is supposed to do so.
Yeah. So
So
yeah.
after he opened it, he gave it to you.
I mean, I'd already opened it.
Okay. She has actually jumped to the broom, or what did they say? Jumped to the fence.
I saw it. I was really mad when I saw it, and then I think I shared it on my status, and then people were like, sometimes they do that, when they have to, maybe you're sick, and then they're trying to find the reason what is making you ill, and then I'm like, still.
But I think,
you
but
still
because
have
because
to
because
tell
of the
me.
sensitive nature
Yeah,
of the
because
disease.
what if you checked and I was negative? Then what?
Exactly. I mean, that's the thing. That because there's just something about HIV tests, the sensitivity of the whole thing. Because before one day I just walked in. I just walked in. I'm like, you know what? I mean, it wouldn't harm a fly. What? Let's just go
Yeah,
do it.
let's
But trust
do
me,
it.
I was sweating.
I mean,
I didn't know why.
but seeing as there
But-
isn't just one way to acquire it.
That's the thing. I talked about this earlier. I mean, when you say you're HIV positive, I mean, our people,
They
the
look at you
judgmental
like, so you're
people, they're
having
like, yes, yes.
Yeah.
Of course, married couple have sex.
It's not just married couple.
No, but
Plenty
I'm
people having
saying
sex
people
these
have
days.
people have sex. So what's the big deal? But the thing is, do it the right way. However, I walked in and I was all sweaty before because the way I was
It's the
being
fear of the
counseled,
unknown. Okay.
the way I was being counseled, like, don't worry. I'm like- I wasn't listening to the lady,
Yeah.
frankly, because she was like, "Don't worry, if it's negative, there are drugs. If it's positive," I'm like, "No, it's not positive. I just want to confirm my negativity. I know I'm negative. I don't go around sleeping." But then I'll on the second thought, I'm like, "Okay, it's not about sleeping. You'd never know what you may have used or what has, pranked you or
Cut
something.
you,
I don't. Yeah,
yeah.
because there was an incident where someone went to the rescue of a bleeding person involved in an accident. There was a cut, and then he also had a cut, and then and then he got it. It was a bad experience. He was saving someone, but hey, only God knows the rest of the story. But yeah, today's World AIDS Day, and so far, I think I'll encourage all of you guys who've not tested yet to please
get
go
a
do so.
test. I mean, I've done it twice.
Just confirm
this
it.
year.
It's not that you're positive. Just confirm your negativity. That's what I said to myself. I needed to, but I was still sweaty because the lady talked about a whole
So,
lot of
Jeff.
things. So Jeff, please, deliberately do so.
After here, I'll decide. I'll talk to the gods.
Guy, behave.
Talk to the
You know,
gods.
there's this tweet that was going around, right? And then this person was talking about how he checks his HIV status every 3 months.
Yes, my brother does that.
Then somebody came to reply that whatever it is you're looking
Before
for,
you
one
find
day
it, you find it.
People are
It's
sometimes
like,
mean,
yes,
but-
like, what do you mean? This could be a person who is sexually active or who
Yeah.
has multiple sexual partners.
Yes,
So they
want
have
to
to
be
know
sure.
that they are clean.
Yeah. But anyway, I mean, a very important day today, especially with those that, have been tested positive, because they would most of the time assume the position of being ambassadors to try to talk to people, to, have protected sex, or sometimes abstain, as they say, is the best mode of prevention and everything. But let me start with Jeff. Jeff, today's World AIDS Day, and so far, what have you been hearing? What's buzzing around?
It's just been reviews on reports on the status so far, and then campaigns that have come
Right.
to help the day in helping remember the day, as well as also helping fight the virus. So
Right.
I think the most recent, which I found from The Guardian, is that there has been a treatment that they've discovered
Okay.
through the combination of two antiretroviral drugs.
Right.
That's cabotegravir. Sorry, I would pronounce the names quite strangely, but it's cabotegravir and rilpivirine that have been combined. So they are going to make it somewhat of a bi-monthly injection for those living with HIV. So should you have
Bi-monthly, so twice in a month.
twice in a month.
Okay.
So every 2 months, you can go in for the injection.
Is it every 2 months or twice in a month?
Every 2 months.
Okay.
Yeah, every
Okay.
2 months.
Okay.
So you can go in for the injection.
Mm-hmm.
The discovery was made by some of the scientists from National Institute for Health and Care Excellence, which is in England.
Okay. So that is meant to what? Further suppress the virus. It's
further
not a
suppress-
cure.
It's not a cure.
Okay.
But then it's to help suppress the virus.
Mm.
I mean, they are saying that the combination of these two drugs
Mm-hmm.
will make the suppression faster.
Mm.
So once they do that, then they can get to see that indeed the patients are now, getting better. Unlike before, where they have to wait for a longer time for the pills to work individually. So combining the two, and they realize, oh, okay, so it works faster and it's more effective.
Okay.
So let's do it that way instead, and then administer to their patients.
The patients.
Yeah.
Okay. Okay, that's for starters, mummy.
Yeah.
HIV, AIDS, today.
Well, I think growing up, we used to see a lot of ads being run here in Abbey's Ghana on HIV/AIDS.
Right.
It's like right now, you don't really see it.
Well, yeah, there was this time.
Yeah, there was a time
sang
there
this
was
song.
songs.
Yeah, songs
there were
made.
adverts.
Ghana All
So
Stars.
many
Yeah,
things.
yeah, that's
Art
true.
stickers going around. You pass by a store, you find it there.
If it's
Yeah.
not on, it's not
Yeah.
in.
It's
not-
I
yeah.
remember that thing
Stop
so
AIDS, Love
well.
Life.
Love Life, yeah.
Yeah.
I don't know if I have that song here.
So somewhere 2000 and.
I think I do. I think
three.
it 2000, in the 2000s, early
Early
2000s.
2000s,
Yeah, I
yes.
think this.
Yeah, this is it.
Whoa, whoa, whoa. Just send nice the messenger to warn you about this
That is
HIV.
right?
Yes.
That's just a
Stop
man.
for you,
Yeah.
Ghana.
It sounds like one of the guys from Guitar.
It's a very old.
Yes, sounds like
It sounds like
yeah.
Oh,
that
yes,
thing,
yeah.
yeah.
Think of it, no, this is the one we got the raga.
Yeah, that's people.
But this sounds like
Pucho, tick tock, my bedroom. You know one country, Mr. What's a Roman, oh, one time. Yata, you go doctor, no king time. Me rap him, me number myself. And yeah, but you have it now with them in time. Me no one come and say, oh, mess up him. Number them who them tick tock, I am pa. I'm out for much of you. Yaren power, off it war. Niti, Pino, Pompo, Mochum, my anything. Now, Miss Matnip him. Me mademo magawo mawaga dolala ya halaga maba ace na manyawo akukuga anya Chicago yenya dam dego na majiba ya kodo ya la lamadeka adona zanu yo ya naba condom la na sila do ya hune na ko inchi fafa na napa du kona no jijim kaba kaba cho kaba 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 kaba
mata da ku muke zamu muku gargadi da wannan mugun ciwo HIV ke kashewa da baba da mamma wallahi kun ji ko wannan ciwon HIV wallahi ba shi da kyau wannan gargadi friction ya rubuto ko kaci ko kaso wallahi mun fada
I remember.
real my brethren.
Oh dear Lord! I mean, this like it brought me back to yesterday, man. We used to watch this in our
Watch
black
this
and white
thing, man.
president's television.
Everybody by the television, you are watching the
Yeah,
video.
I mean, we had the likes of what Ambule in there.
Yeah,
and
Ambule, yeah.
Well, don't forget about a condom.
Now, don't forget about your condom. On your friend the rubber socks. You know you are. I'm not telling
My lad, yes, if you have a check of recognize, those years, you never come live in a paradise.
Who's that?
Black Prophet.
Oh yeah.
Natural robbers make you die like flowers.
I mean, he said, don't forget about a condom and then rubber socks.
Please check and recognize, and just think twice again. My lad.
Who's that? That's one of those gospel.
Sounds like Stella Seal.
Is this? I think so. I think so.
Stella Seal.
Stella Seal. Yeah. That fair lady, right?
Yeah, fair.
She the same
Diana
person.
Hobson.
Okay, yeah.
What's the thing rotation? The basis
I think it was a great campaign. I mean, I think
Actually was.
See,
I don't know
it
why it
was
stopped.
everywhere.
It shouldn't
there was
have.
yeah,
It was
and what you said
everywhere.
was very true. I mean, there was a time in Ghana where the campaign for against HIV/AIDS was very, very,
It was
very
massive.
rigorous.
It
Yeah,
was.
unfortunately, it just died off. Now that we actually have good engineers and good musicians with great voices, well, they want to make money, so it's gonna do. But this is also gonna put you on the map because it's not just a Ghanaian problem, is it?
No,
Nope.
it isn't. It
Nope.
actually is mostly an African problem.
Yeah. Clearly, because on the continent, we're looking at South Africa having the
Yes.
highest, people living with HIV, and all that. I mean, you were talking about a certain reports that shows how,
Yeah, so currently in Ghana, there are 342,307 people in total living with HIV/AIDS. And out of the total number, 122,321 are males, and then 219,986 are females. So there are more females living with HIV currently in Ghana than males.
yeah. How I wish we were able to connect to the lady at the Ghana AIDS Commission to at least try to explain some of these things and maybe what do you call it? But it is like questionable how more females carry the virus than
Males.
Males.
Like, what accounts
But there was
for
a time.
it?
There was a time someone said something passively. It was like because they are the. I don't know. It's because they're the receiving end during sexual intercourse or something. Most of the time, there was just technicality associated to it. It's based on science, biology, and everything, that kind of thing. But it and there's this part of this report I read that says children
Between
the ages of
15
over
and
5,000 between the ages of 15 and 24 years
24 have
in
the virus.
2020.
And I think I don't remember who said it,
Uh-huh.
but the person was talking about how these kids are getting it from older men.
Older men, yes. And I think
And in my head, I'm like,
from the
it
report
doesn't really make sense.
from the reports I read, it has to do with the dependency, where these young ones depend on these older folks.
Okay.
So in turn, they
So,
take
yeah.
advantage of them.
And I think that could account for some aspect of it. But it's between the ages of 15 and 24. You
Yeah.
know how children, are prone to playing with things they see on the floor.
But this is 15 years of age, for God's sake. This
15 is still a
Well,
child.
The
I
number
think
is still a
maybe,
minor, but-
if we're going to still stay on the line of maybe sex, I would
15
probably
is
use
too young.
But people do have sex.
But people,
I
but then
know,
even-
but I don't think it is that much.
that's what I'm saying. On the line of 15,
Mm-hmm.
reason I'm saying is because of the nature of living, or I would say the environment for these young ones who hawk.
Mm-hmm.
Okay, so the hawkers, those in the stations, and because the relationships sometimes
Children as low as
And
15,
yeah, they'll definitely
they
get-
engage in
they'll
sexual
engage.
intercourse. They do.
I get that,
Uh-huh.
but I don't think when it comes to that age range,
yeah, you wouldn't
the
be thinking.
sex will account for a major number of the number of kids that have HIV that young.
What do you think they will be doing? Like, what? Picking up what?
There's so many ways to get HIV/AIDS
Right,
aside sex.
right.
But that's the thing. According to the report, one of the reasons, or one of the major reasons it gave, is the fact that these young ones, depend most or highly on these older folks. So it's like, yeah, I'll take. I mean, you remember when we looked at the high rates of teenage pregnancy, how it's very, rampant in the
Prevalent,
rural
yeah.
areas and all of that, and ask them why. Or it's basically, I mean,
Yeah.
back at home, there's nothing.
There's nothing really going on in some of these places.
And guess who are the guys responsible for their pregnancies? The taxi drivers
Yes,
in the
yes.
community.
Taxi drivers, farmers.
Exactly.
Yeah.
I mean, he has a taxi, right? He transports people through and fro, and then takes his coins at the end of the day.
Yeah.
You don't have anything from home because you want to attend extra classes. You don't have the means to do that. He helps you. At the end of the day, you go to his house. And how does he pay you back? Of course, he gives you a baby.
Yeah, I
You know?
think sexual assault could also come in there as well.
No, but the thing is, Who?
See,
Okay.
when you say assault, because most of them are really consenting to it. They're like, oh, come.
Exactly.
You know, sexual assault actually happens.
It
So
does,
I am
but how many
sure there's
people
a
do
f-
reports?
So I'm sure there's a fraction of the children who are getting the A's from the older
Oh
men
yeah, there's
not
that.
being
There
consensual
may be.
sex.
Oh, there may be
Okay,
that. Yes,
okay,
there
okay.
can be
So
that. We
they
can.
being
Yeah,
forced.
it can be considered.
Right,
But
right.
most of the
But
times.
it still stays on the same transmittability. I mean, you are looking at the fact that it will have to do with massive unprotected sex. So, yeah.
That's very true. Yeah, I mean.
It's just sad looking at the numbers because 15 and 20 between 15 and 24 are very young children.
All right, but very young,
But-
very
Very
young.
young.
But,
And I-
between 15 and 24, when you say young, in what context are you saying it? Because a 10-year-old girl or a 15-year-old girl or boy can tell you stuff that you wouldn't even know
I
of.
get that, but that doesn't dispute the fact that that 15-year-old is still a minor. So it's sad that
Yes, it is. The
the
situation
situation is sad.
is very
and
sad.
I think that also comes from we finding the whole talking about sex a taboo on the continent.
I totally agree
Because
with that.
if you're teaching your children about sex, then you're
Uh-huh.
teaching them safe sex as well.
Very true.
But they will not talk to you about it.
So I think you made mention of 346,000, right?
Yeah.
And 66 female, 34% male. I have a breakdown. So in our base Ghana, at the top of the leading the chats here, Ashanti region 73,000,
Wow.
over 73,000, yes,
Wow.
followed by Greater Accra
Wow.
with 70,000, and Eastern region
Of course.
47,000.
What you mean, of course.
Oh yeah, because at a point in time, they were up there.
Eastern region follows, and then Western region 25,000, then Central region 24,000 plus. Volta region 20,000. Bono region 19,000. Bono East. It goes on and on, and Northeastern region happens to be the least on the table. So yeah, yeah. So it seems for HIV/AIDS, it's the other way round, rather, if you look at it in terms of the infection rates, because when you look at the pregnancy issue, it's more prevalent in these rural areas where you find less recreational or entertainment facilities and blah blah blah. I mean, places you can go to entertain yourself. Well, the lesser the deprived your area, the higher rates of teenage pregnancy. But in this case, Accra, Kumasi, these are popping spaces that you can go actually have fun and all of that. But I believe there are other reasons as well. Okay, Mummy, got something to share?
I think people should just learn to practice safe sex. I mean, there's this relationship expert who gives advice on TikTok.
Yeah.
And when she starts to talk about sex, she's like, if I tell you people now to not have sex,
You won't
and
listen.
You won't listen. I'm lying to myself.
Right.
So if you're going to do it, just do it in a safe way. Have safe sex,
Right.
protected sex, and try to limit the number of sexual partners you have.
Yeah. Yeah.
And then be careful. I mean, about the things about sharing spoons, about sharing cups, and I've heard about stories where people get it from
Body
people-
fluids.
people get it from body fluids. I mean, you can get it through kissing. You can get it through.
HIV?
No.
HIV? I thought
Yeah.
that was hepatitis, rather.
No, I mean, if a person has a sore in the mouth and you don't know about it.
Okay.
That's
okay.
if the person is infected.
Yes.
Very
So
true.
there's that, and then there's so many ways where you can get the virus. So just take care of yourself, especially we're in the month of December.
Right. Everybody wants to go out there
And
and
they
pop.
have tagged December, which is supposed to be a holy month because that's the month our Lord and Savior was born. They have decided to tag it Dirty December.
You're kidding.
Oh, you don't
That's
know?
the tag.
That's what they call it now.
That's the
That's
tag.
what they call it now. Dirty December.
Are you excited?
I mean, I don't partake in it.
Oh,
So
really? You see, everybody's just laughing.
I mean, I don't partake in that in December.
Right.
I'm
Anyway,
just saying.
yeah. So let me bring in Jeff. Jeff.
Yeah, with regards to prevention, right? I can say that we have the Free to Shine campaign organized by African First Ladies. So
Okay. Okay.
this is a continental thing. It was launched in 2018 in Addis Ababa.
Right.
And this is for the prevention of mother-to-child transmission
Right.
as part of the factors that can, cause
HIV. Yeah. Because someone could be
HIV.
born without.
With the
It's not their
virus.
fault.
It's not their fault, but
yeah.
then because the mother may have it, they transfer it onto the child
I think
through
that-
breastfeeding, I think. So
Right.
with the Free to Shine campaign like this, Ghana's own happened in 2019 with
Okay.
the current First Lady, which is Rebecca
Yeah,
Akufo-Addo.
Akufo-Addo.
Yeah. And that's what they've been on for now. So more campaigns like that, and then still on the message of abstinence. If you know, you're not going to. But then again, people are of this day
Yeah,
and
right.
age looking forward to explore. The best would be giving them options to
Yeah.
ensure that they have more protected sex. There's so many contraceptives now on the market. You can walk into a pharmacy right now and inquire.
Can a contraceptive prevent?
I think he's talking about
Condoms.
Condoms.
Okay, condom.
Yeah.
Okay.
So they
Right.
found
Right.
prophylactics,
Yeah.
contraceptives, and so on and so forth. So.
Okay, yeah, that's all right. And there's also an initiative by the AIDS Commission here in Ghana. It says they are targeting zero new infections by 2030, just like the SDGs. So we're hoping to see that manifest. This was after the launch of the 2020 World AIDS Day at the Ministry of Information Conference Hall in Accra. That's last year. So the whole idea is to, get a zero infection rate or no case in 2020, no infection in 2020. So that's what they're looking to achieve. It says, speaking at the event, the global solidarity, shared responsibility, and Ghana adopted the theme "Stay safe, let's end AIDS by 2030." The director of the Ghana Health Service, Dr. Patrick Kuma Abuaji, urged people living with the virus to stick to the antiretroviral therapy, ART for short, to reduce AIDS-related deaths. I wonder what's going to be happening this year. Yes, in 2020, yeah, we still had COVID, but this time it's kind of like it's doubled up. Omicron is here, so I wonder how they're going to complement those. But yeah, it doesn't change the fact that HIV/AIDS is real, and let's be safe, and let's try to go do some, even if it's yearly, one would say every 6 months at least. The show is Africa Day every 6 months, yeah? All right, that's all for our discussion zone on World AIDS Day.